Hi, this is Dr. Shanine Sachadina, a breast surgeon here in Orlando, Florida, and the founder of the Central Florida Breast Center and the We Mentor You website. We are launching a campaign for breast cancer awareness. If you feel something, say something. So, this is a global campaign where, in other parts of the world where women do not have access to mammography, some of the only signs that they will see will actually be lumps or changes in their breast. And so we are advocating for frequent self breast examinations in order for early detection. So, how do you do a self breast exam? The breast itself is not just the mound that you feel. The breast itself actually goes all the way up to just underneath your collarbone, here to your breastbone, just above your abdomen, and then all the way up into your underneath your arm. Now, when you are checking for your breast or changes, look for any skin changes that you might see. After that, you're going to feel the breast. Take the pads of your fingers and feel every portion of the breast, up and down, in a circular manner, whatever is most comfortable. Make sure you actually squeeze the nipple because you're looking for any kind of discharge, especially if it's bloody. The facts speak for themselves. Approximately 1 out of every 8 women in the United States is expected to get breast cancer sometime in her life. Though breast cancer is more prevalent in the middle and the older age group, approximately 5% of cases occur in women in their 20s and 30s. Therefore, you are never too young to get breast cancer. Early detection equals survival. In certain cases, however, women may need to start their annual mammograms early. This would be in patients who would be considered high risk. Consult your doctor to find out when you need to start your mammogram. With a family history of breast and/or ovarian cancer, those patients are especially at risk and need to seek medical advice in regard to when to start their screening. So let's discuss some of the risk factors for breast cancer. Besides having a personal or family history of ovarian cancer, it's important to look at your family history. What is considered high risk would be if you had 2 or more first or second degree relatives from the same side of the family that have breast cancer. Other risk factors that we look for are if you had your child after the age of 30, if you have taken hormone replacement therapy for greater than 5 years, if you did not breastfeed your children, or if you started your period under the age of 14 but had menopause later after age 50. So how can we impact upon this disease? There are certain things we can do. For example, regular exercise. Studies continually show that if you get into a regular exercise program, you can reduce your risk for breast cancer by half. Eating a healthy diet, low in fat and high in fiber, is also important. Minimize your alcohol intake and maintain a healthy weight. As far as hormone replacement therapy is concerned, if you need it for quality of life issues, then go ahead and use it. But if not, then try to avoid it. Though there is no way to completely 100% prevent breast cancer, you can certainly lower your risk. The key here is to catch this disease by early detection. So how do you accomplish early detection? You start with a diligent monthly self-breast exam. Get your annual clinical examinations when you're supposed to, and get your annual mammograms after age 40. Report any changes in your family history to your doctor. So what are the things that you would be looking for on a monthly self-breast exam? Certainly a lump would be something that you would be checking for. I like the slide that you see before you because it truly speaks to how important it is to get your annual mammogram in your clinical exam. The smallest of the circles is the average size lump found on a mammogram. The largest of the circles is the average size lump found by a woman who doesn't examine her breasts each month. You are also looking for the changes in your breast where they may look a little funny. If you look at the slide, the right breast is larger than the left breast. You will see that the nipple is inverted and the skin is shiny. Those are the things that we would be looking for to have the patient report to us. You're also looking for any kind of indentation in the breast, such as this. Another thing to check for is discharge from your nipple, especially if it's bloody. Though most bloody nipple discharges are benign, meaning not a cancer, there has been associations between bloody nipple discharge and breast cancer as well. Here are some tips about how and when to do a self-breast exam. Always try to do it between day 10 and 15 of your menstrual cycle. If you are in menopause, pick a day, either the beginning of the month, the end of the month, whatever time is more convenient for you, but do it the same day each month. And always use the same exam technique, and I will go over that in a minute. And if you find something, make sure that you seek medical advice. In regard to self-breast exam, I would refer you to the internet as there are some wonderful sites that show you how to do a monthly self-breast exam. But the key points are that you should do it in front of a mirror, standing up, and also laying flat on your bed. This way you will be able to check your breast in 2 positions. Always make sure if you're doing a self-breast exam to check the nipple for any discharge, as we have just shown you. Finally, keep a diary of any unusual findings that you may have. You can recheck that area in the months to follow, and if it is still present in the following month, make sure that you seek medical attention. There are many techniques to doing a self-breast exam. You can go up and down on the breast, you can go in a circular fashion, or you can come in from the outside into the central portion, which is the nipple. Whichever technique you're comfortable with, just make sure that you use the same technique each month. Assume that you find something. It is important to seek medical attention from either your primary care doctor, your OBGYN, or a breast surgeon, but not your friends. Though 80% of all the lesions we find are not a cancer and only 20% are, it is important to get professional advice in regard to your changes. So when you do present to your doctor, the general course of events is as follows. They would do a medical exam that would be followed with some form of imaging, most probably a mammogram and probably an ultrasound if there is a lump. Once that examination is completed, you would then go to a breast surgeon. The breast surgeon typically would get a biopsy of an area that they are concerned about using a needle biopsy. A needle biopsy is basically where you take a piece of the tissue and you submit it to a pathologist. This is done in the office and requires only local anesthesia. Once a biopsy has been obtained and a diagnosis has been given, assume that there is a diagnosis of breast cancer. My advice to you would be to discuss your options with your surgeon. Make all decisions based on facts, not fear. And you do have the time to make a decision that you're comfortable with. Remember, breast cancer is not a surgical emergency. The more educated you are, the more comfortable you will be with your treatment and your treatment options. Knowledge is power. Finally, remember, your life may depend upon doing a monthly self-breast exam and getting your annual mammogram in a timely fashion. Breast cancer knows no boundaries and can occur in any community. Therefore, it's important for us to unite and embrace the facts. After all, we are all one community in the battle against breast cancer. To my global family, please remember, breast cancer does not know gender. It can occur in men, though it is rare. So we all need to remember, if you do feel something or see something, then say something, because we know early detection improves survival.